Josh, I'm a paramedic with London Ambulance Service. What's your name?
Hello Josh, my name is Louis.
Okay, Louis, what's been happening today?
Oh well, for the last couple of days I've had this cough. I haven't been feeling well, and then recently I started to get a bit short of breath, and it really panicked me, so I called an ambulance.
Okay, that's not really good to hear, mate. So when did your short of breath start?
Well, I guess it started about 2 days ago. It didn't start off too bad. It was barely noticeable, but now I can't even walk a short distance without feeling like I can't get enough air.
Okay, so it's been progressively getting worse. Would
Yeah,
you say it's worse at night time or when you're walking up the stairs?
It's a lot worse when I'm walking up the stairs. At night time, I don't really notice a difference. I mean, the cough gets a little worse, but definitely on exertion, I feel really breathless.
Okay, so you're not able to carry out daily activities?
Not without feeling short of breath, no.
Okay, so have you been wheezy over the last couple of days?
Not that I've really noticed, no.
Okay, and you said that you had a cough as well. Can you tell me more about the cough?
Yeah, so the cough started about 2 days ago. It was initially dry, but over the last kind of 24 hours, I started to bring up like a rusty yellow phlegm.
Okay, and so your cough, is it worse at night? Is it worse during the day?
It's about the same on both. I don't think I noticed too much of a difference. Maybe in the PM it's a little bit worse.
Okay, but you don't have any blood in your cough at all?
No blood, nothing like that.
Okay, excellent. Now, have you got any other symptoms? Do you have any chest pain at all?
Yeah, now that you mention it, when I get really short of breath or when I cough, I do get this chest pain kind of across my chest.
Okay, and can you describe the chest pain for me?
Yeah, it's really sharp.
Okay, so more sharp stabbing. Now, is there anything else that makes it better or makes it worse?
Yeah, when I cough, it makes it a lot worse, and if I breathe really heavily, it starts to hurt a little bit as well. But if I rest, it kind of goes away.
Okay, now if you take a big deep breath in for me.
Oh, yeah.
Okay,
Oh, that's
okay,
really tight, yeah. Oh,
Okay,
yeah,
no
that's
pain.
it, yeah.
Okay, and then when you touch it as well?
Yeah.
Okay, now have you tried anything to help ease the pain? Any paracetamol? Or...
Yeah, I mean, I took some paracetamol at night time, and it brought it down quite significantly, and I was able to get a good night's sleep.
Okay, that's really good. So with your chest pain, does it radiate anywhere? Does it go to your chest? To your jaw? Does it go to your shoulder tips?
So it's in my chest, kind of on both sides. It doesn't go to my jaw or my back or even my shoulders. It just feels like it branches across my muscles here.
Okay, and do you have any other symptoms associated with any nausea, dizziness?
Definitely no nausea, no dizziness or vomiting. Sometimes I get a bit short of breath, but like that's, I don't think that's to do with pain so much.
Okay, and your pain, on a scale of 1 to 10, 0 being no pain at all and 10 being the worst pain it's ever been, what would you rate your pain at the moment?
I mean, at the moment, talking to you, it's probably like a 2, but when I'm coughing, it really brings it up to a 6.
Okay, so that's as worst as it's been. Okay, excellent. Okay, so any other symptoms? So have you been having any weight loss recently that's abnormal for you, or any night sweats at night?
I haven't noticed that I've lost any weight or anything like that. But now that you mention it, last night I woke up in a really cold sweat, and that kind of carried on throughout the whole night. I did get my wife to check my temperature, and I was running a fever. I think it was like 38 or 38.5 or something, so that might have been the reason.
Yeah, have you been having any blurred vision or any headaches or any rashes either?
No rashes or headaches or no problems with my vision.
Okay. So do you have any past medical history?
Yeah, I have asthma, and I've been recently diagnosed with COPD.
Okay, and do you take any medications for those?
Yeah, I do. I take a blue inhaler for when things get bad, and I've got a brown inhaler that I'm meant to take every day.
Okay, excellent. And you've been taking those quite regularly then?
Yeah. I don't feel like I'm getting any relief from my blue inhaler.
And would you say that this shortness of breath episode, would that be an exacerbation, or is this something that you've never had before?
This feels like something different. I mean, I wouldn't have called you guys, but it feels like something like I've never had before.
Okay, that makes sense. So have you had any significant respiratory infections in the past, like COVID, tuberculosis?
Never had COVID, never had TB. I have had a few chest infections before. My GP just gives me antibiotics and they kind of clear up.
Okay, makes sense. And so your drug history, do you have any allergies at all?
No.
No allergies, and you don't have any allergic reactions to food or anything like that?
Not that I know about.
And you're not getting any allergic reaction symptoms, so your throat's not closing up, you don't have any hives that are forming?
No, nothing like that, no.
Okay, excellent. Now, social history, are you a smoker?
Yeah, I smoke.
And how many would you say you smoke a day?
I smoke rollies. I probably get through like 8 or 12 a day.
Okay, excellent. And how long have you been smoking for?
Oh, since I was 16.
Okay, so quite a long time.
Mm.
Okay, do you regularly take or do you take recreational drugs?
No, I don't do any drugs.
Excellent. And what about alcohol?
Yeah, I do drink like just socially, I guess.
Okay, perfect. So do you take any herbal medications or over the counter?
No, I don't take anything like that.
Okay, excellent. Now, your family setup, do you live here by yourself? Do you live here with your family?
Yeah, so I've got my lovely wife and I've got my 2 children as well.
Okay, excellent. And would you say you're quite supported in that environment?
Oh,
Is someone
gotcha.
always at home?
Yeah. No, I've got people to look after me.
Excellent. Now, have you been shooting and your family been shooting?
So, in the light of all this pandemic and stuff, I have been shooting as advised by my doctor because of my medical conditions.
Mhm.
But my family, I mean, my wife still has to provide, and my children are still going to school, so
Okay,
they're
makes
not
sense.
really shooting so much.
Now, have your family had any of these symptoms at all? A cough or a temperature?
No. They've all been pretty healthy.
Okay, excellent. Are any of you are you or your family vaccinated for COVID?
No, I don't think we've been offered the vaccination yet.
Okay. Now, what did you used to do as a job? Were you working with any chemicals or anything like that?
No, nothing like that. I worked at a bar for 30 years.
Okay, excellent. And I'm assuming there's been no trouble recently.
No, the government's got that on strict lockdown.
Yeah, very true. So now what we're going to do, I'm going to go through a physical assessment.
Okay.
So if you're happy, we'll take off your shirt and then we'll start investigating if we can find
Yeah,
a
of
reason.
course, absolutely.
Now just looking around as well, there's quite a few puffers, which you said you've been using. Do
Yeah.
you have any home oxygen roll or?
No home oxygen. I've been using my blue puffer, but I'm not getting a lot of relief with it.
Okay, makes sense. Okay, so on initial inspection, it doesn't look like you've got any intercostal muscle retractions, and it doesn't look like you're using personal breathing or any tripoding positions, which is all really good to see.
Great.
At the moment, your chest is symmetrical as well. One thing that's a little bit concerning is that you're a bit tachypneic, okay, which might indicate that there's an underlying reason for why you're quite short of breath, okay. Now, can I please grab your hand? I'm just going to have a quick assessment. Now, having a look at your hands, there's no signs of clubbing. There's some tar discoloration, which may be because you smoke quite a few cigarettes. Excellent. Do you mind holding your hands out for me? Okay. So there's a small sign of asteraxis, which also might be due to the fact that you've got your COPD. Okay. Now, if you can put your hands down your side again, we'll do another assessment. Now, I'm just going to have a quick look at your face. Okay. And now I'm just going to pull your eye down. Okay, excellent. So it doesn't look like there's any signs of anemia, which is very positive. There's also no signs of Horner syndrome. Your pupils are also equal and reactive, and there's no signs of swelling anywhere else. Excellent. Having a look at your neck, there's no sign of tracheal deviation, and there's a good size within your cricoid and your sternum. Okay, do you mind sticking your tongue out for me? Perfect. Now there's no signs of any cyanosis, which is really good. I'm just going to have a feeling of your lymph nodes. Excellent, and then it will feel swollen at all. Perfect. Excellent. What we'll do now is a JVD assessment. I'm just going to get you to lie on the bed for me and just lie at a 45-degree angle.
Okay, sure, sounds good. Perfect.
Excellent. Okay. Now I'm just going to come around this side and have a look. If you angle your head to the left-hand side for me. Okay, excellent. I'm just going to feel your abdomen. It's going to be a bit of pressure. Okay, excellent. That's all normal. What we'll do now, sir, is we'll just move back over the seat and we'll do another assessment, okay?
Okay, sounds good.
Excellent. So what I'm going to do now, I'm just going to go through and palpate and just make sure that everything's normal.
Okay.
So, if you just have some big breaths for me. Excellent. And now one more time. Excellent, that all feels quite normal. I'm just going to go around to the back and do the same thing, so keep breathing for me. And then one more time. Okay, excellent. Okay, so now I'm just going to do another assessment, okay? Now what I want you to do, whilst I've got my hands here, I need you to say 99 repeatedly, okay?
Okay.
Alright, ready?
99, 99, 99, 99, 99, 99.
Perfect, excellent. We'll do it to the back as well. I was positive there's no signs of surgical emphysema either. I do apologise, and once again,
99, 99, 99.
excellent. Perfect. So in that assessment before, I did notice some increased vibrations, especially in the lower lobes, which could suggest that there could be some consolidation or potentially a chest infection. I'm going to do another assessment called a percussion, where it's just going to be quite similar before, and then I'll go onto your back and do the same thing. Okay, so just take some big deep breaths for me. Excellent. Now I'm just going to move the back to do the exact same thing again. Okay, excellent. Quick one. Excellent. So once again, there was a when I was doing my assessment, there was a bit of a dull thud-like resonance in the lower areas as well,
Sure.
which also suggests that you might have some consolidation.
Okay.
What I'm going to do now, I'm going to have a quick listen to your chest. I'll go front and then back again,
Okay.
just to see if we can hear it.
Sure.
So take some deep breaths for me. Excellent work. And one more. Excellent. I'm just going to go around the back again to the exact same thing. Just lean forward for me. And the same again. Couple more. And last one. Excellent. So once again, there's some consolidation that I can hear in the lower lobes. So what we can do now is we can get your shirt back on.
Okay.
And whilst we're doing this, I'll get my crewmate to come over and take some observations. These will be a temperature, a blood pressure, heart rate. We'll check your sats as well. We'll also go through a peak flow, a cap refill, and also just a 12-lead ECG as well, if you're happy with that.
Absolutely.
And just with that lungs auscultation before, there was also no wheeze or stridor, which is positive to see.
Great.
So it doesn't look like you're having a COPD exacerbation.
Fantastic.
Perfect. So all of the observations have come back normal. The only thing that's abnormal is your rest rate, which is quite high, and also the fact that you're spiking a mild temperature. So both of these could both lead to the fact that you're potentially having an infection somewhere. Okay. A couple of questions about infection sources. Have you got a UTI at the moment or any other symptoms of the sort?
I mean, I haven't noticed anything different about my urine. I've had UTIs in the past. It doesn't feel that way.
Okay.
And I can't think of anything else that would be causing
No
infection.
abnormal bowel movements and no cellulitis or anything like that. Okay, so I think based on that, it's most likely that you're having a chest infection. Okay. So I've completed the assessment. Okay. So over the course of the assessment, there's a few red flags that have been raised, I think. Okay?
Sure.
So these would be the fact that you're short of breath over the last 2 days, the fact that you've got consolidation in your lungs, and the fact that you've got spiking your temperature, you've got quite a fast rest rate, and the fact that you've got this productive cough. Okay?
Sure.
So there could be a few different differential diagnoses. One could be the fact that it could be your COPD exacerbation. Okay. Another one, it could be the fact that you're having a PE, or it could be the fact that you've got COVID potentially. Okay. I think our working diagnosis and what we'll treat for is our respiratory infection. The reason I'm leaning more towards this is the fact that you've got consolidation in your lungs, the fact that you're spiking your temperature, and you're quite short of breath as well. Perfect. So going through the differentials, I don't think it's a PE based on the fact that you're scoring a 0 on the Wells criteria, and you also haven't had any long distance travel recently, increased stasis, or medications that will increase your coagulation. Okay. I don't think it's a COPD exacerbation based on the fact that it's been going on for 2 days now, and you don't have a wheeze, and it doesn't really feel like your COPD exacerbation. With COVID at the moment, with the community transmission, it's quite likely that you might have COVID. Okay. Based on the fact that you've got that temperature, you're short of breath, and also you've got lower SATs, which also might be because of your COPD, but it could be the COVID, and the fact that your family hasn't really been self-isolating. Okay. Alright. Perfect. So there's a couple of ways we can manage this presentation.
Sure.
Okay. I think that at the moment we can start by giving you some paracetamol to help with that pain. Following that, LAS policy is that anyone with chest pain comes to the hospital just so they can get you some bloods, take some bloods in order to identify if you're having anything cardiac related to your chest pain. I think once you're at hospital, what they'll do is they'll also take an x-ray just to confirm that you're having a chest infection. They might take some sputum culture as well. And then once they do that, they'll then treat with antibiotics. Okay. I think also the fact that you might have COVID, they'll do a COVID test as well, and your family are going to have to isolate for the next 10 days. Now, if you're not happy with that management plan, the other way we can go is down the GP route, where we can have a conversation with the GP and then try and manage in the community and at home. I think the recommended route would be the first one, the first option.